Okay, again, we're doing CPR today. This is the BLS, Basic Life Support. This is skills 10 and 11. So this is the one with an infant. Right now it's winter of 2021. We always in HOSA are using the American Heart Association guidelines. So if you're taking a different first aid, make sure you're looking at American Heart Association for HOSA and how some of those things are a little bit nuanced or different, both for your written tests and your practical. And obviously we're doing a virtual conference this year, so as far as these skills go in your videos, I want to teach you how to do it correctly so that you can be planning and learning the right thing. But in the future for your videos, for your mystery scenario, we'll give you tips and tricks about what this is going to look like. It might be using a pillow for compressions. It might be I might have a fake AED to print out some things for you to work that. So this is the infant that you would use in person because you aren't responsible for owning one of these at your hostess school. But if you do have one, it might be good for your filming and for practicing because, again, the point of hostess to be learning. So if you have access, it's something you want to be practicing with this winter. But if not, the things that you would bring, you're going to bring, a bag valve mask and make sure you know how to work these things. Montana HOSA would provide you with the mannequins. And so just so you kind of know, the mannequins that we're using in Billings light up, which is kind of cool. It's a new feature. So this one, his diaper turns on. And then as I do compressions on him, you can see those light up there on the bottom. So right now it's blinking red because I'm not doing very good CPR while I'm holding him by his neck like this at you. Sorry about that, little guy. So for infant CPR, I know this is one of the ones where the guidelines for American Heart Association are changing right now this winter. In February, we roll over to some new curriculum. Know that for your written test this year for HOSA, it is on the old guidelines. So make sure you're checking the rubric as far as what you're going to be tested on. And if you're watching this, maybe this spring, this fall of 2021 for the upcoming 2022 year, know that this is changing. So these videos might still be on our website until we get the new standards released. So just kind of be aware that some things might change. And I know that infant CPR is one of those that have changed. So Rescuer 2, okay, remember you're the CPR person that initiates CPR. Rescuer 1 in the meantime is taking care of their first aid patient, and they're going to come and help us and do 2 rescuer CPR once they're free. So every scenario, the scene is safe, my BSI, my body substance isolation, or my PPE, my personal protective equipment is going on. Again, at state in a real life scenario, this is equipment that you're responsible for bringing. So you're going to put your PPE on, your gloves and your goggles and that kind of thing. And then for babies, we would check the responsiveness just like we did on adults. But with babies, we don't tap them on their shoulder. We're going to tap on their foot, okay, with like 2 fingers. So baby, are you okay? And the judge will let us know that there's like no response. Again, I want to activate the emergency response system if you're watching our other videos. So I'm going to call to my rescuer 1 and ask for help, activate, call 911, and get an AED. There is no AED available on any of the infant scenarios in this, so just know that there's no infant AED, so it's not available. And just like before, I want to check that CPR might be the appropriate course for this patient. So I want to see if they're breathing, and I want to see if they have a pulse. With babies, we check a brachial pulse in here. So again, I'm going to feel for a brachial pulse for no less than 5 seconds and no more than 10. In the meantime, I'm watching for chest rise and fall. Again, I kind of like to have a hand on there to feel for that. The judge will tell me that the baby is either not breathing or they're not breathing normally and that they have no pulse. That tells me I want to initiate CPR. I want to make sure that my baby is on a flat, firm surface. I want to be at their side. And this is one of the things that's going to change in the new guidelines. But at this point, we're still using 2 fingers right in the center of the infant's chest, right below their nipple line. So again, you'll see that they have nipples, and I want to be right below that nipple line with my 2 fingers. And I want to do 30 compressions with 2 breaths when I'm alone with this baby. And so as a single rescuer, I'm going to do 30 compressions. As always, you want to make sure you're hearing a clicking noise, that you're getting deep enough both in adult CPR and on infant. And again, these will light up on the diaper and tell you that you're doing good. Ideally, we're looking for 2 green dots on there. So 30 compressions. Again, I want to let the judge know that I know that that rate should be between 100 and 120 per minute. I want to let them know that I'm going at least 1.5 inches deep on my baby in the depth, and that I'm allowing that chest to recoil every time. Remember that heart needs to fill up with blood, and if I don't let it recoil, it can't fill up with blood. So that's an important piece in effective CPR. After 30 compressions, I'm going to do 2 breaths. Again, right now it's winter of 2021, and with COVID, we're not doing breaths. But make sure you know how to work one of these. This is a pocket mask. This is infant size. You can see from my other videos, obviously quite a bit smaller. Your same filters that your school might own or buy for you in your training will still fit that. It just fits on the different end. But this protects both of you, and we would do 2 breaths. Same tips that I was telling you before for adults. We want a head tilt chin lift. We want to press on that hard plastic. Again, just smaller in size with everything. And my breaths are small. They're just little puffs. Little breaths in there. 2 breaths in there over again 1 second, because I don't want that fast, rapid pulse. And I'm going to keep doing this until my second rescuer arrives. When they arrive, I'm heading as rescuer 2 because I'm tired, my fingers hurt, up to the head, and I'm going to use a bag valve mask. Again, as you come to stay in a live situation, you're responsible for bringing this, knowing how it works. And you're going to need an adult size and an infant size. This hose connects to oxygen in a medical setting, but we can also use a bag valve mask without using the hose, so you don't have to connect this to anything. I can just give room oxygen with this thing. So same techniques as before, that CE clamp with the head tilt chin lift. This guy will puff out, and I'll watch for that chest rise. Rescuer 1, you're coming through, and this is where your technique changes. Instead of doing the 2 fingers, we're going to do what's called the thumb encircling technique. And so I'll kind of, again, bring this through. But my thumbs are going here as I do this, clicking on that firm surface, and I'm around. One of the things that's going to change in that new guideline is that we're able to use that all the time. With 2 rescuers, we switch to a rate of 15 compressions and 2 breaths. Again, we'll do this. So rescuer 1's doing the thumb encircling. Rescuer 1's doing that. Rescuer 2, the CPR person, is doing the bag valve. After 5 minutes, or 2 minutes, 5 rounds, excuse me, you'll switch. Again, after switching to that new side, doing around there, the judge will let you know that EMS has arrived. You'll remove your personal protective equipment properly, putting it in the biohazard, and use your hand sanitizer. So just make sure you know the difference between adult and infant CPR, know how to use the bag valve mask for that age group, and that's it.